Well, thank you for having me. My name's Logan Abrams. I wanted to express my gratitude, first and foremost, to Perfusion.com for welcoming me down to Southwest Florida. I'm from the Pacific Northwest, so this has been quite a treat. And I'm grateful for you all for being here to hear about my thesis research study, which is the comparison of Hemosep and cats in washing stored packed red blood cells. I'd also like to thank my research partner, a fellow classmate, Bryce Davidson, and our program director, David W. Holt, for their contributions and our efforts on this project. So I'll give a small introduction to the reason that we had this project in the first place, state my hypotheses, our protocol, our results, some discussion with our results, and conclusions. The only disclosure I have is that the materials that were used in this study were donated by the respective companies that are represented. Looking back into history as we prepared for this research, we've seen that transfusions have been a subject of interest for a long time. Starting in 1665, Richard Lower completed the first successful transfusion. 100 years later, Philip Physique completed the first human transfusion. And sometime after that, we were deep into trying to use transfusions as a regular practice in order to maintain life. However, there was a paradox that came with transfusing patients, which was blood did not always bring the desired results and sometimes brought death instead of life. And this leads us to the idea that we should clean and preserve the red blood cells that we are going to eventually transfuse to patients. One study that caught our eye came from 1916 by Drs. Rue and Turner, and in their words, which I thought said it best, there is practically no mention in the literature of attempts to keep red blood cells alive in vitro. Red blood cells have little of the ability to adjust themselves to changes in external conditions. We have asked ourselves whether injury during washing might not be responsible for the brief survival of washed cells. And we asked ourselves that same question in preparing. In 2004, J.R. Hess et al. Described that stored red blood cells had acquired storage lesions, which is really where the target of our research came, was an ability to remove these storage lesions. These include loss of 2,3-DPG, loss of ATP, damage to the cells, and increase in potassium, as well as plasma-free hemoglobin. If these components of the blood that we transfuse are not washed, then we're exposing the patients to the untoward consequences, as they've stated here. Schmidt et al. In 2016 recognized that the effects of washing improve this situation by removing potassium, cytokines, and allergens. They found that cell washing mitigates deficiencies in stored packed red blood cells. Thus, the conclusion was made that there are some problems with just banking blood and storing. There's lactic acid, and there's the amount of time that these red blood cells are stored. As we know, red blood cells are not all the same age in circulation. Many are at different points during their 120-day life. And the longer we wait, the worse that the storage becomes. Thus, we came to the conclusion that we will wash the blood, but how should we do it? Our hypothesis in comparing two different machines, the CATS device and Advances Surgical out of England's Hemosep device, was that there would be either no significant difference in the washing techniques of these two devices, or that there would be a significant difference in the washing techniques of these devices. So if you're not familiar with the Hemosep device, here's a picture of it. Let's see if my pointer's up here. So this is somewhat similar to a platelet agitator and a collection reservoir. Gravity then brings the blood that's collected down into this bag, which is laid across the agitator. I'll have an in-look view of the bag next, but once the processing is complete, it flows again by gravity into the transfusion bag shown here. So here's an up-close look at this bag. as you can see, there's two separate layers. The blood travels by gravity in above the membrane and is then agitated. The superabsorber layer below the filter then draws liquid across, and untoward or undesired impurities into this layer, which can then be discarded easily as it absorbs. The remaining packed red blood cells and platelets or other components, if it's collected during surgery, are passed by gravity onto the transfusion bag. So our methods were originally biphasic. First, we would collect and store porcine blood in order to test both of these machines. Second, we would process and analyze the quality of the wash. Our blood was collected from Hormel Foods in central Nebraska and concentrated using the Autolog device. 400 milliliters of red blood were placed in each bag and were stored for 21 days at 1 to 6 degrees Celsius. Our sample size was determined by the statistical team in needing to be greater than 25. So here's a small picture of our collected blood that's been stored. After the 21-day time period, we took a control sample and processed each volume with the CATs and Hemosep. We then used the EPOC device to obtain the following values for comparison: H&H, potassium, sodium chloride, calcium glucose, creatinine lactate, and carbon dioxide, oxygen, and pH. For our processing, we primed the CATs machine, placed 100 milliliters from each of the bags into the machine, and then washed by centrifugation. Samples were then drawn off of the transfusion bag line once we saw that the 100 cells from that bag had been processed on the module. A similar process was completed for the Hemosep according to their desired technique. 100 milliliters for this device is originally placed into the bag for priming and rotated. Then 100 cc's of blood was placed into the bag, followed by a wash volume of 400 cc's. The platelet agitator then processed for 40 minutes as required and was taken by gravity into the transfusion bag where samples were drawn. So here's a small look of our different samples in the syringes. We also took an original sample for our control from the storage bag. In addition to the EPOC for analysis, we also used a traditional centrifuge. Here's a quick look at our data results, which can be large and difficult to see, but we wanted to show the individual statistics. The comparisons were made with a p-value of 0.05, and the Kruskal-Wallis test was used to determine the distribution of each lab value between groups. If a value was considered statistically significant, the Mann-Whitney test was utilized to complete pairwise comparisons using the methods of Bonferroni. Here's an additional table that shows the p-values for each of our comparisons and more easily seen summaries of the findings. There was a clear statistical significance in favor of both devices in their ability to wash against the control of stored blood. In a comparison between the two devices, there was statistical significance in favor of the Hemosep in oxygen, sodium, potassium, chloride, glucose, and lactate. There was also a statistical significance in favor of the CATs for hemoglobin and hematocrit. As we looked at our results and talked with Jim Trickett, one of our collaborators on this project, we noticed some inconsistencies with previous research that had been done in looking at how the Hemosep compared for use during surgery. Because of these inconsistencies, we came to the conclusion that perhaps the Hemosep bag had more residual wash volume than originally thought, which was causing our hematocrits to be much lower. Just to consider and take a look at that, we were prompted to do a follow-up study in which we took blood and washed it simply to see if the residual volume was 100 cc's. In our follow-up results using 10 bags of blood, we found that this was not the case and there was a decent amount of residual volume found. Because of this, we applied the average for residual volume back into the hematocrits from the original study so they would be less diluted, and found that if that had been the case, and hopefully a future study will better clarify, that the statistical significance for H&H in favor of the cats may not be conclusive. Thus, we would recommend both devices for storage lesion removal in packed red blood cells. We recognize a gentler approach as far as the variables that were measured in favor of the Hemosep, and would again suggest that we reconsider how the hematocrit is affected. These results were then in support of the few studies that are available on the Hemosep product that we had previously seen. One example here from Dr. Günyadin of Turkey, who saw differences in hematocrit, EBC, platelets, serum albumin, fibrinogen, and IL-6, looking at the benefits in platelet blood dynamics as well. As far as future studies go, we would again recommend that we look at the residual volume effects in the bag, look at how these devices both are used in a clinical setting for washing packed red blood cells, not just blood collection, and then focus on and recommend to each group that they always try to use the best blood product possible in order to prepare their transfusions. I'd also like to acknowledge and thank Elizabeth Leiden of the UNMC Statistical Office for helping us, Jim Trickett, who was a great mentor in helping us, and Christine Sweats, Lance Fristow, Scott Sandstrom, Jeff Carpenter, and Hormel Foods for their contributions to this study. Just a quick view of our references, and thank you again.